Good evening, Bistro fans. It's Jill here with Dr. Cole.
Hi.
Thanks for joining us. So
Here.
look at us go. We're committed. We got what?
I'm so impressed.
I know. On our weekly Chiro chats, and Dr. Cole is here with us tonight. She is from Advanced Animal Chiropractic, which is a team of both you and Dr. Grant Tully, who is also her partner in life. So you guys work, a lot of people are familiar with chiropractic care for themselves as humans. We go to the chiropractor. Mm-hmm. But if you could give us a little bit of an introduction about animal chiropractic and how that is a little bit different than the human world from what people are mainly used to if they go themselves.
Sure. So if you're already familiar with human chiropractic, it's pretty simple to explain. So human chiropractic really focuses on structure, and the premise is all about making sure that your spine is moving as well, is functioning optimally, basically, and moving as well as it possibly can, so that you don't get areas of inflammation buildup or anything like that happening, which can lead to, discompression and pinched nerves and a whole slew of different things. So that's the general premise behind it. And then when you apply it to animals, the premise is the same. It's still about structure. We're still wanting to make sure everything is moving properly in your pet. The difference really comes up in how it's done. It's super, super underwhelming. So we always joke that a lot of folks, we kind of have to warn them ahead of time that it's not hike on my table and, lay on your side, and there's no popping, there's no cracking, there's no like gross manipulation. It's very, very gentle. And the nice thing about it, though, is even though it might look like your dog or cat is just getting lots of pets and rubs, it is super effective, and there really isn't a placebo effect. So if you're going to get improvement, you get it pretty fast, and there's nothing that I can do or that Grant can do to kind of convince Fido that he feels better. Like either you see a difference or you don't. So we do see a lot of symptomatic animals, and that's a little bit easier because you can see a difference in the symptoms to know you're at least moving in the right direction. But it can be a little bit tougher when you have pets that are just coming in for preventative care or something along those lines, as far as like noting a difference. But a lot of times the folks that are coming in for prevention aren't really looking for a difference. They just want to make sure that they know like that their pets are sound, and that's our job to do that anyway. So whether it's something that's symptomatic, asymptomatic, or preventative or maintenance, anything like that, it's super effective. It's one of those things where we're not very salesy folks. So like if we don't think what we're doing is helping, we're happy to tell you to do other avenues, just because we understand as pet owners, you're just trying to do what's best for your pet. And especially if you're on a limited budget, which truly all of us are, you want to put your money towards the best option that might help your animal. So we're definitely not types to have you guys keep coming for months and months if we don't really notice any change.
Perfect. And yes, I know a lot of people think that many times chiropractic care might be more involved with your pet, just because that's what we're used to. We're used to upfront, if we go to the chiropractor ourselves, that we have to have multiple visits a week. Mm-hmm. And I know that's often not the case with animals, and we're not asking them to contort and twist and move in ways that are asked of us many times. And then I totally agree with that. Sometimes it's just either, I always say you're your pet's caregiver. If they're off. Right. If things don't seem right, or if they seem like they need an adjustment just by some of the characteristics, whether they're acting weird or, maybe, for example, I've had cats that have fallen and twisted funny, or I know if, there's been a scuffle in the house that someone might need it more than another, but there's always like, intuition always plays a role in that too. When your pet really needs to come in for a chiropractic adjustment.
Yeah, absolutely.
Good. So today's fun topic is knee issues. And I know there's lots of, I would say would you say this is more common with dogs than cats? Not really a cat thing per se. However, I do know somebody recently who had cruciate tear with cat who underwent surgery for it. So does it happen in cats? Yes, but it's pretty rare. I would say that's probably the first time in many, many years that I've heard of a cat having cruciate tear.
Yeah, we've only ever had 2 cats that we work on that had cruciate injuries. It is super rare. I think it has to do, I think they have different angles in their hips. Their whole knee structure is a bit different than the dogs. So
yeah,
and they really don't do a ton of the motion that oftentimes causes the injury, because cats kind of slink along, whereas dogs are much more straight-legged, and they just kind of propel themselves in a different way. So I think that plays a big part in it too. But yeah, you're definitely right. This is definitely way more of a dog topic. Right. So we apologize, cat folk. We will find a topic for you.
We have plenty of topics. Don't you worry for cat people. We just need to get around to them. That'll be another week.
We can do that.
So tonight we're going to talk about knee issues. So why don't we just do a quick list of what might be a knee issue? Maybe people don't realize some of these acronyms and letters that we put together actually have to do with the knee or the leg. Some people don't know how that all is all put together. So why don't we run through a quick list of what knee issues might be with dogs?
So there aren't a ton specific to you'll hear the term stifle a lot, which is synonymous with knee. So we just say knee. It's easier to kind of explain it. But the most common things you see in our pets with knees is meniscus tears, cruciate injuries, which is kind of similar to a human ACL tear. It's not the same, but similar concept. And then we have a lot of luxating patella dogs, which we'll do a whole talk on that eventually too, because that's huge, where the kneecap actually floats in and out of the groove that's supposed to hold it. And then you can always get like a tendonitis. You can always get, how humans get like tennis elbow, golfer's elbow, like dogs can also have similar things like that happening in their knee. They're just not as common because they're built a little bit better than us. And same situation, they're not repetitively doing like a tennis motion or a golf motion. So it's not quite as common, but I would say between meniscus, cruciate, patellar luxation, and then you can get into like hip, a little bit in the ankle. But other than that, you do get a lot of arthritis and that sort of thing in there too. But those are probably the top 3 that we would see when it comes to knee issues.
Mm-hmm. And then just for anatomy's sake, knees are with dogs only on the hind legs. So we don't have, there's no knee per se in the front legs. So
nope, they have elbows. So.
They have elbows. They have elbows. And then for, and sometimes too, I think people see if there is a tear or an injury and the dog shows lameness or they're picking up one of the legs and they're not using it. Some people then tend to think maybe there's a hip involvement or maybe not thinking the knee is actually the causation of what they're seeing. So diagnostic testing is always great to have on occasion as well, just to know exactly what's happening too.
Totally.
All right. So we are going to talk specifically more about cruciate injuries, and that's something that you have been seeing a lot more of.
Sure.
So
it's a huge issue is the cruciate injury. And I would bet that I know that growing up, I didn't really ever hear much about it. And now all of a sudden I feel like I hear the term, my dog has a cruciate tear or a cruciate injury. Granted, we're in the industry, but even if I weren't, I feel like you could ask someone else that isn't, and they've probably heard of someone who's had a dog that had that issue. Whereas, 15 years ago, 20 years ago, I really don't remember it being quite as in your face as it is now. And that could be from a variety of different issues that we can kind of dive into. But just for a little bit of background. So the cruciate injury is the most common injury in the dog knee. So 9 times out of 10, when you go in and your dog is limping or 3-legging it or having like toe tapping on that back leg, it's probably due to a cruciate injury. Now that might be secondary to something else, but that's probably what the problem at hand is. Like, just for a generalized number, and this is from 2003. So just imagine what that would be 17 years later in 2020. In 2003, cruciate surgeries, which again would have been costing less back in 2003, brought in over $1.3 billion in the veterinary industry in the United States alone. So that's billion with a B. That's a lot of cash. So think about how many surgeries were being done to create that kind of like gross revenue. And you have to think about it. Most cruciate surgeries, depending on obviously the year and how serious of a surgery you're getting, because there are 3 different kinds, which I'm not going to dive into because that's obviously not my expertise, but there are multiple kinds that usually the vet will recommend one over the other, or you'll have different experts that prefer to do one surgery over another. But they range anywhere from like $1,000 to like $2,500 per knee. That's a lot of money. And
I've even heard prices higher than that.
Yeah, or more. Well, I know at least we have friends that are down in Florida that there's different vets that are trying new ways to help the cruciate injury, like the cruciate ligament itself, just because they're not fans of the current surgical aspects. So a lot of times when they're trying to develop something new like that, it ends up being more expensive. Even though it might be a better surgery, it could end up costing a lot more out of pocket. So at this time, that's kind of your standard. I would say most folks that come in that have had it done or considering it are looking at about $2,000, give or take. And that is strictly the surgery. That is nothing else other than going in, doing the knee and coming out. That's not rehab. That's not supplements. It's not
diagnostics.
No, it's not diagnostics, nothing like that. So you're looking, when all is said and done, at a lot more than $2,000. Not to mention, I mean, pretty much every vet will tell you when you go in with one injured, they're going to tell you right then and there within a year, expect the other one to blow too. Now, that being said, any cruciate injury I have seen, I think of all of the ones we've looked at and worked on, I think there have only been 3 instances where our patients have actually had to go get surgery. So Garrett and I were talking about this earlier. It seems that the common factor is the smaller your dog, the better the chances that you don't end up needing to go through with a surgery. I don't know if it's just because there's less weight on their knee, because you're able to pick them up, because it's a bit easier to limit them. There's all of those factors. Now, the ones that we've had that have gone in to get knee surgery tend to have multiple factors too. They either have a totally torn ligament, which is possible. They either have 2 cruciate injuries where it's both legs are affected, or they tend to have meniscus involvement as well. So it's very rare that it's just a partial tear that we've seen that needs to end up going in and getting fixed. It tends to be that there's some kind of compounding factor as well. In addition to that, a lot of these folks have younger dogs that just are very, very difficult to keep rested and keep down. And that's kind of the same protocol, whether you do the surgical route or you do the alternative route. Like, you do have to be pretty cognizant about keeping your pet a little bit more low key, which isn't an easy thing to do. Now, just as a general statement, whenever we do see cruciate injuries coming in, whether it's a very minor sprain all the way to a full tear, we will tell you that everyone recovers a little bit different, and you are going to have a lot of ups and downs. On the days when your dog feels good, 99% of the time they're going to overdo it unless you are like militant on making sure that their activity is limited. And we are totally fine with movement in your pet. We understand it is not realistic for somebody that comes in with a 3-year-old dog for them to be told that that dog's not allowed to do anything for 8 to 12 to 16 weeks. It's not going to happen. Like, it's just not going to happen. That dog is going to have to do something. Otherwise, he's going to get destructive and something bad's going to happen in that sense. So we always tell you the most pivotal times are usually those first couple weeks, where if you can keep them a little bit more low key, focus on very, very short leash walks, things like that aren't a bad thing. You want your pet to maintain muscle tone. So even if you have a full tear, if they're at least doing controlled leash walks, and that being said, these aren't like 1 to 2 mile long walks. They're short little jaunts to the mailbox, or walks around your backyard. Even if you have something like that, at least getting them out and having them attempt to use that leg can be a huge, huge factor. You want their brain to still initiate that back leg and kind of communicate with it. If they don't have the opportunity to try to use it, then it's just going to atrophy and you're not going to have any muscle tone to work with as the dog progresses, right? So just like with a human, when you injure something, you kind of have to baby it. And that's part of the reason why a lot of times the other ligament is so susceptible to being injured. And I think that's why a lot of folks will seek out chiropractic, even if they do end up getting the surgery on the injured knee. It's oftentimes very, very helpful for the one that's the healthy leg. The healthy leg is compensating, right? During this entire time, whether you've had a surgery and you're doing 12 weeks of rehab, or whether you want to go the alternative route and just try to see if the knee will heal on its own. No matter what, the healthy one has got to up its game to help the one that's injured. So through chiropractic, we can at least help make sure that knee stays as stable as possible and that hip doesn't overcompensate. Because a lot of times what happens is because it spends so much time with, caring for the weight of 2 instead of just 1, that'll destabilize the knee itself and then end up having a much weaker ligament in that sense too. So chiropractic can help in the healthy leg in that sense. On that same token, we like to think that with the injured leg, by making sure that everything is lined well, by trying to keep the swelling down, by keeping the injured hip moving properly, that it allows for that ligament to heal the way it should and build scar tissue. So when you think of like a ligament healing, it's never going to rebuild like that initial ligament to ligament consistency. It's the scar tissue that you're kind of looking for. The scar tissue is what basically rebinds it and helps heal that ligament. The reasons knees take so long to heal, and actually just ligaments in general, is there's not a lot of blood flow to that area. So you're not getting this constant flow of helpful healers basically to your knee. That's not something that's super common. Whereas if you had an injury somewhere else in your body, you do have quite a bit of communication and like blood flow and all that jazz. So that's why it tends to take so long. Even if you do, whether you go surgical or alternative route, cruciate injuries usually take a solid 12 to 16 weeks for a full heal. And that's pretty much banking on your pet not going backwards at all, which is super duper common. Most of the time what we see is that your first 4 to 6 weeks are quite up and down. And that's with you guys coming in to see us. So this is with us, like our protocol. So I would say the first 4 to 6 weeks of your cruciate rehab with us is very up and down. You'll have several good days, and then usually you'll have a couple bad days after your good days because they've overdone it. That's okay. It's a lesson. It's a learning experience. You need to be able to push the limits to know what they are. And every week they get better, they get better, they get better. And we'll talk about it a bit later, but there's a whole slew of awesome supplements and other things you can do at home to kind of give that knee the best ability it can possibly have to heal. And there's a lot of great natural anti-inflammatories. There's a lot of great joint support that you can do. But there's a lot of things that the human can just do, in the sense that the main reason these knees get injured is from the zoomy and the juking back and side to side motion. So I guess I should have probably started with this. Sorry, guys. But your cruciate ligament is similar in animals as to humans, except its positioning is a bit different. So a lot of times folks will come in and say, my dog's ACL is torn. Your dogs don't have an ACL. They have what's called a CCL. It's their cranial cruciate ligament as opposed to their anterior cruciate ligament. Similar in concept, not the exact same thing between the two. It is a little bit different of a job. So your dog's knee should not move front and back at all. That's a very stable joint. The lower half of the knee should never go forward. And that's the point of the ligament. It helps do that. It helps stabilize when you're going in that side to side play motion. Its whole job is really to stabilize, right? And you've got a bunch of muscles that cross over that joint too to help in that sense as well. But when you've got a weakened ligament right there, it usually tends to have issues upon full extension and upon the side to side movement. So really, the reason we see so many cruciate tears, I mean, it can kind of vary.
Real quick, and just to help understand, because I think there's some terminology, and what you're describing is some people will hear, if they go in for a diagnosis, their veterinarian, what do they call it? Like is it like a drawer test or something like that is what they call it, which has to do with like side to side motion, which should not be there. Correct?
Right. So with your drawer, if my dog wasn't sleeping right now, I'd pick him up and show it to you. But if your dog is laying on his side, or even if he's standing up and I'm facing you and this is my leg, right? So, and my toes are facing you, Jill. So my toes are this way. Mm-hmm. And you shouldn't see this motion. Okay. Right. That's what the drawer test is looking for. They're trying to, if you get motion in that joint, that's a problem. That shouldn't be there. So it's funny though. There's a lot of folks that will say they actually think the drawer test a lot of times ends up injuring it a little bit more, just because if you already have a little bit of a partial tear, to kind of wail on that joint a little bit,
I can see that
can definitely cause more aggravation. So,
so I just wanted to clarify, because I think people like hear that terminology, or their veterinarian maybe during a diagnostic test kind of throws that out, but people don't really know what that means, and it's kind of going along with what you were talking about, and how the joint, it shouldn't be moving, it should be stable.
Yeah. So, and similarly, we'll get a lot of folks that'll come in and say, my vet diagnosed a cruciate tear, and if the thing is, either they did the drawer test, but if they didn't do that, you can't diagnose a cruciate tear on x-ray. So cruciates are soft tissue. You can diagnose that with an MRI. You can heavily suspect it with a drawer test. And obviously, if it's a very drastic drawer test, you can. But much like a lot of things in human, like those things they're high reasons of error. Like some dogs have a little bit of weird laxity in there and they might not have an issue. Whereas others, maybe they're not moving at all and they could be fully torn. It's kind of a case by case basis, but it's like a general guideline. So that test isn't infallible. And an x-ray isn't going to show you anything with regards to the ligament. The only thing it's going to show you is if it is so torn, I guess the only thing I could see is if it shows literally the lower portion of the knee moved in front of the upper portion, which shouldn't be like that.
Right.
Super common. And the only other thing I could think is a lot of times folks will see a lot of arthritis in the knee, and because of that, they'll suspect that there's something more going on. So I think that there's nothing like x-rays are a great resource for us to see what we're working with there, but it's not going to positively diagnose your dog with a cruciate injury, Right. So not many people are going to go spend $2,500 on an MRI to diagnose a knee injury when you can spend less than that and get a surgery for it, right?
Totally. I've been in a surgery before where the ligament's been essentially, replaced.
Yeah.
And and sometimes you don't know what you're getting into until you get in there. Is it partially torn? Is it fully torn? I mean, fully torn, usually there's, the dog, it has lameness at that point, or there's toe touching and pain associated with it, whether that's the dog being yippy or yelpy, or having some sort of outward pain being expressed. But yeah, so I totally agree with you. If you're gonna, if that's what's suspected, what's the point of spending the same amount of money on an MRI?
Yeah.
When you could just repair it and get the dog feeling better.
Right. And a lot of things I feel like in the veterinary world are things that if they fit if the symptoms kind of fit within what's to be expected of a certain condition, it's most likely that condition. I mean, it really comes back to they cannot tell you. They can't tell you anything. We can't say, hey, does that hurt? And some dogs aren't super stoic, but most of them are. So we've had pups that have come in that have been fully weight bearing, but then upon examination, they will have no muscle tone. It blows your mind. You're like, this has to have been going on for months,
right?
Yet somehow they're weight bearing. It's very confusing. And I think that for cruciate injuries, it's not usually the time of injury, I will say, does tend to be pretty painful, because in that moment, you'll usually hear a yipe. Something will go on. A lot of folks will say their dog was running in the backyard and then came up and they were one leg lame, and crying. But I think after that initial part, it's not often that it's too painful. It's more so just annoying. They don't really understand why they're being restricted by that. Like, why isn't that leg working right? But animals are so adaptive. You can see it all the time. They'll just hike it up and go. So it's really interesting. Like, tripods is a real thing. They have no issue like chasing after a bunny on 3 legs. And that's part of the problem, is they don't limit themselves. So we kind of have to be our pet's advocate and do that for them, at least in the beginning. So I would say that there's a couple different things that predispose a pet to a knee injury, right? So definitely age is a big factor. I will say we've seen quite a few senior dogs that end up having issues in their knees just because they're older. When you get older, your ligaments are a little bit more lax. You've also got arthritis. You've got all these cofactors. So you do have a propensity to have issues. That being said, those dogs do awesome with chiropractic care, and they tend to respond quite quickly. And I don't know if it's because they're older, so they're not as meaty muscly, so it doesn't take as much to get them to a point where they're pretty even side to side, but they do great. And then it's one of those things where very rarely is someone going to go get surgery done on a senior dog. I've seen it happen. I wouldn't recommend it because they're older. You just never know. And it's not painful. So let them heal up. I mean, a lot of times the reason folks don't want to try a wait and see approach with cruciate injuries is they're worried that they're going to develop excess arthritis because they're not getting the surgery done. And because their dog is having to, wear a little bit differently on their back legs. But when you have a senior dog, like, they already have arthritis. So at that point, why would you put them through surgery? So that's something to think about. The other thing that really predisposes pets to issues in their knee is like repetitive traumas. So we see it a lot in athletes, a lot of athletic dogs, a lot of dogs that are hunting dogs, fly ball dogs, dock dive dogs, dogs that they just driven to the ball, like things like that. Check your yard. A lot of people have little mole holes all throughout their yards. Like, your dog doesn't even have to be that active. If you've got little divots throughout, like, a lot of times if they step in that wrong, that can cause some issues too. So that repetitive.
And then we started talking about the drawer, you're also talking about like dogs running back and forth and zigzagging and things of that nature too, putting that extra pressure on the knees.
Yeah, it's a huge thing. And I mean, most of the time when you watch dogs, that play bow into that side to side motion, it's hysterical to watch, and they should be able to do those things. But if you have other factors that are playing a part, it can cause them to be predisposed to issues like that, and that's oftentimes a situation where you do see it blow. Another thing that's kind of been speculated about, there's not enough research on it yet, but I'm a firm believer in it, and that hormone imbalance has a big part in it too. So there was a huge study that was done regarding, it was a golden retriever study talking about how animals that are neutered or spayed very, very, very early, that don't fully develop, a lot of times they have a propensity to have these orthopedic issues younger and more often than their counterparts that waited a little bit longer. So I've noticed definitely a trend recently that there are several vets out there that I think have started to ask their clients to wait a little bit.
Yeah,
I think is awesome. We did it with our pets, and it's hard when you're rescuing a dog because a lot of rescues are so nervous about backyard breeders that they really don't want to give you a dog unless they themselves get them neutered or spayed right then and there. But if you're getting an 8-week-old puppy, I mean, I just look at that like, you're taking an 8-year-old female or 8-year-old male and chopping off their goods and not allowing them to really develop, and that's
you mean 8-week, but yes.
Well, I meant like a kid, like a human.
Yeah. If you compare it, yeah.
I wouldn't want my child to not have the ability to develop, right? Like, they have to go through puberty, right? Like, that's an important step of life. Otherwise, we'd have a lot of really squeaky, high-voiced people walking around with no facial hair. Like, it'd be really weird. But I think that it just logically, to me, makes sense that these pets, they need to develop, and whether that's at a year. Some animals, large breed dogs, a lot of times go up to 3 years before they're fully developed. You just kind of have to be a very responsible pet owner. And granted, that's a total topic for another day, especially because a lot of folks will say, well, the testosterone is too high, it's not good with my other dogs or whatever. And I get that. But I think when it comes to orthopedic injuries strictly, and that is all we're talking about, I would say if you have the ability to wait to spay or neuter for at least one heat cycle until they've at least developed a little bit to where they're not, still this gangly little thing and have, 50 pounds left to grow. That has a big toll on their body structure. So there was one study done. I'm sure there's many others in the works, just because that's a big deal. That's a lot of dogs.
With the study, what is the premise behind it? Is it just more like hormonal, or is it actually based on structure development?
Yeah, it was more focused on orthopedic injuries and why, and that sort of thing. So I think they tackled on a lot of different aspects of it, but that I think was the biggest takeaway, was that these Goldens, I can't remember the exact stat, but it was high. I mean, we're talking more than like 75% of the dogs that were spayed or neutered very, very early were that much more likely to then injure, have a cruciate injury. And it's not even like just a general injury. I mean, it's straight up like a knee or a hip injury. So I think that's a huge thing that really needs.
And it kind of makes sense. I mean, the body's all interconnected, and we have all these tissues that, it's just like going to the chiropractor for yourself. Your knee hurts, but they're working on your left shoulder. You're like, how does that have anything to do with my knee?
It definitely does. I would say another predisposing condition is there's definitely like a big difference between some breeds. So like Huskies, Malamutes, like your Nordic breeds have an actual different hip angle than your standard. And even I think Dobermans might be in that too. And sometimes a pity thrown in there, but there's certain breeds that have a structural difference. And I don't know if it's because, in the north or wherever they come from, they are meant to be outside and they're meant as sled dogs. They're meant as X, Y, and Z. So they might need a different angle back there. But because of that, I have seen a lot more injuries in those breeds than others. A lot of times we'll see it in dogs that have hip dysplasia. So because their hips are so out of whack, their whole life they compensate for that and they end up having weakened knees. So that's a big thing too. Whenever you have a pet that has problems in their hips, the likelihood that something's going off in their knees is pretty high. That's a big one as well. And then lastly, I would say a huge part of it is just straight up inflammation. If you have a pet that is very inflamed all the time, that is like attacking their soft tissue. It causes a constant state of irritation, which leads to weakened ligaments. So I would say I would think that a lot of dogs that swap off of like a pro-inflammatory diet and swap to a more cooling diet, something that allows the body to kind of go into that heal mode instead of go, makes a huge difference too, I would say, in the recovery time. Just because think about it for yourself, like if you're as a human and you've injured some part of your body and all you're feeding yourself is Taco Bell, that's a very inflammatory food, right? Food group. So it doesn't matter if you like it once in a while, but if you're eating that every day, that's a problem. If you swap over to some really good nutrition, we're talking like complete meals, your body's going to heal so much better because it can just function better. So those are all kind of predisposing factors to knee injuries, right?
Mhm.
But what I would say is that, honestly, Grant and I were talking about it. I think we've only had a handful of dogs that have ended up having to have surgery. And like I was telling you guys, it tends to be the very large breed dogs or the ones that have other things going on as well. Most of the time, these cruciate tears can do really, really well healing on their own. They just need, they need rest, but they also need moderate exercise. It's a lot of dedication from the human, and I think that's the hardest part for people to wrap their head around is it's not a stop in, let's do a surgery and you're good to go. It's a very continuous, we probably need to see you consecutive weeks for X amount of weeks so we can make sure you're stabilized while you're healing. And, you also have to do these exercises at home, or you also need to look into doing some cold laser therapy, or, you need to invest in some of these supplements. So it might seem like a big commitment. And I think as a human race, we're pretty commitment phobic. So it's tough for people to wrap their head around that, like with cruciate dogs, we have to make it very clear that it does take some time. Like you're going to get there. But what we've noticed is, and I suspect it comes down to once that ligament is almost maybe like 70% healed, somewhere in there, all of a sudden they start healing very fast, which is super cool because it's like you're trekking up this mountain, right? And then all of a sudden you're like, oh, I'm at 70%. And then it's like, shoom, down you go. You heal up so much faster. So it's nice when you get to that point, but it takes time to get there. So, we're really good about I would say your standard protocol for any kind of cruciate injury with us is ideally there's at least 4 weeks in a row where we see you once a week. And then after that, we kind of make a game plan based on how they're responding. Some dogs respond super duper fast and can be spread out a lot earlier. Other ones take a little bit more time depending on like the cofactors. So if you've got, hip issues, if you've got a dog with a luxating patella as well, if you've got an age thing going, if your dog's older, there's a lot of different things that kind of go into place. So we kind of cater it to what is working for your dog because everyone kind of needs a different cocktail to work for them. But along those lines, we're always happy to show you guys exercises to help them strengthen at home. We're always happy to give guidance on anything. I mean, it's a stressful situation, but at least with knee injuries, I always tell people it doesn't hurt to wait. Worst case scenario, you give it 3 months with the alternative route, and they're just not where you want them to be. There's nothing wrong with you calling and scheduling a surgery at that point. I think most people you'd have fear of missing out if you scheduled a surgery like 5 minutes after you get diagnosed with a cruciate tear, and perhaps your dog would have been fine going a different route without ever having to get, sliced into. So it's one of those things that a lot of folks are worried about, this arthritis that'll develop while they're healing. But what about the arthritis that develops from the surgery itself? So there's like a catch-22 there. So I guess the way I look at it as a human is I've had knee injuries my whole life. I have torn both of my cruciates. I have torn my meniscus. I have a hypermobile meniscus, so it moves. A lot of you guys, when you come in, you'll notice that I have knee pads because I can't not wear them. It's a problem. And most days I'm a little sore by the time I get home because it's rough on my very misshapen knees. But I have never had to I've never had to do surgery. I do, I do rehab. We do everything we can to strengthen all the muscles around the knee. So that way it's got that support. I know I have bad knees, but because I know that, I can do everything in my power to make sure I have a good support system. So that way, when they do get injured, because it's not a matter of if, it's when, they're at least a faster recovery time, and it's not painful and I'm not laid up from work because my knees are messed up. But that's the difference. Like, surgery would literally be my last result. I mean, I could be 80 and someone would say, you really need to get a cruciate, this surgery. I'd be like, I've done it like 20 times before. We'll be fine. Like, it's okay. You need to do X, Y, and Z. And it involves a lot of patience and commitment to doing things differently. And I think that's hard for people. We have a lot of folks that their dogs will be doing great even after 1 or 2 adjustments, which is not the norm, I should say. Like, a lot of folks will come in and expect their dog to be like good to go after 1 or 2 for a knee injury, and such is not the case. I wish the body healed that fast, but it doesn't even heal from a sprain that fast. So it does take some time. You know, the magic takes a little bit of time to work. But the worst thing we get is when we'll do a follow-up and say, how are they doing? And it'll be, they were doing great, so we let them off leash, and then they chased a bunny, and now they're limping really bad again. Well, okay, that's fine, but we have to revisit how we're going to handle these tears. So as long as folks are willing to listen and understand that it's a process and it's not going to be overnight, and you're still looking at weeks upon weeks upon weeks to heal, surgical or non, you know, these guys can do totally fine. And it's just a matter of really just committing to their health and their healing and giving them 20 to 30 minutes a day of your undivided attention for rehab, or 5-minute leash walks, or if you've got a pool, they can swim for a little bit. Like, there's all different sorts of things you can do for them. It's just a matter of doing them. So I would say that's about it. I mean, chiropractic is awesome for them. We're big proponents of laser when it comes to cruciate injuries. It's really, really effective at getting inflammation down and helping stimulate like your mitochondria and healing and all that jazz. So it's awesome. I know you guys have a laser at the bistro, which is really great, because it's helpful when we have clients come in that we can do both of those things, even on the same visit. Or obviously, it's fine to always come back a separate day and do it then too. So it's really, really helpful. I think you guys even have one that you can rent out. I'm not sure if you guys still have.
So if you have an animal that you can't bring into the store, or you want to do it, you know, a daily protocol for infrared, especially maybe right after surgery, we do have a rental laser. So it's $199 for the week for 7 days, which is super affordable compared to if you buy a package at your veterinary office and you don't have to do the running back and forth. And that takes time out of your day, and, you know, if the clinic's behind or whatever that is. So you could actually manage to do laser therapy at home. And it is infrared, so it is pretty amazing. I've used it on myself, and I've used it on some of our employees. I've had different knee issues or injuries, traumas, you name it, and they all have nothing but awesome things to say about it, even after just one treatment sometimes. So it can be really beneficial for sure.
Awesome. And you can do it multiple times a day if you're renting it. So I would say that's a huge, huge positive of the cold laser. Acupuncture can be super helpful as well, just kind of making sure you get that stagnant energy moving and out of hanging out in the knee joint. Water therapy is huge and awesome. You just have to do it at the right point during healing. I will address one thing really quickly, is a lot of folks will ask about braces. We are not big fans of the brace early on. I guess long-term, depending on the situation, sometimes with an older dog, it's not a bad idea, because you know you're not going to do surgery and they might just need a little bit more support. When you've got a young dog, going the bracing route is rough, because it definitely always gives them a crutch. And sometimes they become too dependent on it, or in that same sense, sometimes they feel too secure and they push themselves too much. So I will say, and that's a personal opinion, I don't know how other folks feel about it, but Grant and I usually don't recommend people going out and buying a brace right away. It's one of those things that we kind of have to see how your dog is responding before we'd say, okay, you guys should really look into doing this now. Because most of the time, the best braces are not cheap. They're like custom made for your pet. You know, they're like hard braces, and they're very effective. And I would say, if you have a large breed dog and you know for a fact that you don't want to go the surgical route, that's not a bad tool to have at home. However, just like the neoprene ones that a lot of times you'll see advertised that like a lot of humans will wear that have the hole for your kneecap. Those I really just think they're a waste. I don't know that I've ever really seen anybody benefit from them. I mean, maybe there are a few folks, I don't know. But at least the ones that we've worked on, we try to avoid going that route unless it's absolutely something we think is unavoidable.
I would imagine it's also probably very difficult to keep that on a dog just because of their hair. And I mean,
it's not a one size fits all, you know. You just be like, well, I have a small dog, so let me get the small, but I have like a small long dog or a small dog with tall legs, or you know, there's so many different factors, and I just don't know that that's something long term they need to use. I think it's a different story if you have an elderly dog that's just not getting better and surgery is not an option, then sure, go for it. There's nothing wrong with it. It's not going to hurt. But I do think it can hinder healing.
Understandable. So I had a question that just kind of popped up in my head. So if you have a dog that, or a client has a dog that was out in the backyard running and came to the door holding their leg up, or maybe yipped, and you know, that of course that incident of them chasing wildlife in the backyard, you see it, they cut the corner too quick, they yip, they retracted their leg. How immediate do you think it is, or how important do you think it is, how soon to get in to have a chiropractic appointment?
Oh, geez. I would say definitely within a week, within a pretty quick time frame.
So the sooner the better.
The sooner the better. And I would say truly one of the best things you can do if you ever see that is ice your dog instantly, because it'll help prevent the swelling from happening too quickly and then causing further damage. So if you ever see something like that happen, I usually tell folks to give it a solid 24 to 48 hours and see whether it was just, you know, they rolled something wrong, they stepped on something. That way we can at least rule that out. If it's still pretty prominent after about 48 hours, then I would say it's time to get in to make sure everything's okay. But in the meantime, you can ice them. Always want to check their paws, make sure they didn't step on anything. Like gentle massage to make sure a lot of inflammation doesn't pool up in that knee. Those sorts of things are really, really helpful. But sometimes you have to think of it like a human when you roll your ankle. Those first couple of days can be really rough, but then you tend to be pretty okay, pretty fast. So we like to give it a little bit of time just to heal on its own accord, or just see where like your baseline is, because those first couple days of injury are so acute and your body is so inflamed that you just don't really know what you're working with. If you at least give it a couple days, we can kind of see what our baseline is. So I would say if you have something like that happen that doesn't clear itself up, or you have something like that happens that every couple of weeks it's happening, then that's something that you'd want to get in fairly quickly.
Good. And I was just going through here some of my other quick thought processes when you were talking. I'm glad you mentioned that you guys offer exercises, because I know that is huge in rehabbing or helping your animal, leash walking, small walks, things of that nature. Because I know that sometimes we forget that we can also do things at home, whether it's stretching or icing or doing different exercises with them, core exercises, balancing exercises, things of that nature that will help. And I always use the analogy when people or customers come into the store and they're trying to envision like how chiropractic would help my dog's knee or help my dog's body in alignment. And I always use the analogy of getting a blister on your foot. If you go for a long walk and you still have several more miles to go and you get a blister on one foot, say it's your right foot, you start walking differently because you're compensating for the pain and you're compensating for trying to save your foot for the rest of the walk. Well, by the time you're done with your walk, your left foot now has a blister because you're compensating and walking differently. So it's like you always have to manage. Chiropractic helps manage that. It's almost like they're off kilter. So you have to get, once you get the opposing hip or knee back into alignment, that a lot of times we don't have the other knee blow out or give way or torn.
Yeah.
And then even puzzle games. I know a lot of people forget about like interactive toys or puzzle games, especially if you have that young dog that's super active and crazy spastic and you need to burn energy off. We often forget that we can also do puzzle games or feed them, feed their evening meal on a licky mat or any kind of interactive toy where they actually have to work to get their dinner out of it. And mind and mental stimulation can be just as exhausting as doing a 2 or 3 mile walk. So sometimes you just have to shift your focus from the physical element to the mental stimulation to keep them active through that healing phase of you trying to keep them on crate rest for 8 weeks or whatever that is, and not also lose your mind. Because all your dog wants to do is chase the squirrels or run after things or
absolutely
be naughty. So those were just kind of recapping, and I think it's really fascinating. I know we get this question a lot from customers of, do you wait till after a first heat cycle? There's a lot of controversy right now amongst both rescue and veterinary world of how long do you wait? Do you wait a couple of heat cycles? How long for your male dogs before you neuter? And I think it's a really valid point. I actually mention it to customers quite often when they ask that is, how big is your dog? Because if you have a large breed dog, you might be opening yourself up to having your dog have cruciate issues later on in life, and that there are studies and reports coming out about that. And it really makes people stop and think, especially with breeds that are prone to cruciate injuries and knee problems, that, is it really going to hurt to go through 1 or 2 heat cycles with your dog over having possible lifelong knee issues, which nobody really wants that, especially with a large breed dog. It puts a lot of strain and stress on us to pick the dog up, carry the dog, maneuver them around in and out of the house or back and forth to vet appointments. And that can be challenging. So I've had greyhounds and full-size dogs, and I know what it's like to pick them up out of bed and carry them outside to do their business and bring them back inside. And it can be very stressful and hard on us as well. So picking up a large breed animal, so
not an easy thing.
No. So thank you for bringing that up. I think that is something that's not really talked about in the veterinary conventional side of things so much just yet.
No, not yet. Hopefully soon.
Yeah. All right. Anything you think we're missing on cruciate? I know we did a good job covering most of it.
I would just say, lastly, that you guys have some of my favorite supplements for cruciate injuries. So we love collagen. It's one of our favorites. We got so geeked when you guys carried like a whole slew of them, all different kinds. Collagen is usually really tasteless. It's easy to put in their water. It's not going to hurt your dog, whether they're 8 weeks old or 15 years old. It's a great, great supplement. I would highly recommend that every animal be on it, just because it helps support the current joint support system you have in your body, rather than fighting this constant battle to rebuild. Collagen just kind of helps everything stay where it is and really make sure those pillows between everything are nice and fluffy. We love collagen. We're big fans of fish oil as a natural anti-inflammatory. Obviously, you know how I feel about our CBD supplements. It's my fave. But when it comes to any kind of joint or knee, you guys have Connectin. That's one of my favorites too. The same can be said that we talked about collagen with glucosamine and chondroitin. Like, there have been studies that show that if you can get your pets on those things at a young age, it's so much more beneficial than trying to play catch up later in life, because you're not going to be able to rebuild what you've lost. But at least if you start when you're younger, you can help maintain throughout their lifetime. It's a lot more effective. So a lot of times we'll have folks that'll say, well, my dog's only 2. They don't really need to be on any of that. Or they'll say something about how the food might have it. But in all reality, the amounts of levels of those things in food is not what we'd really want for what I would say a successful preventative thing. It's never going to hurt, but I would rather you be giving a supplement separately, unless you're feeding raw, then that's a whole different thing. But, raw diets are really awesome because they're not super inflammatory, and we can do that on another chiro chat, but we're big fans of it. But any other diet, I really think you need to supplement with some kind of joint supplement starting at a young age, whether that be a fish oil, a collagen, a glucosamine, something needs to be in there. I know just from a human perspective, I've been on supplements for joints since I was 15 years old. Probably should have started younger, but in all reality, I think it's helped with my abilities to do things longer in life. And it's something that it's never going to hurt. So why not? You give your kid kitty vitamins. Why wouldn't you give your dog their vitamins to make sure they have a nice, long, healthy life? So we're big fans, but Jill knows I love collagen and CBD. Those are my favorites, but all the other ones are good. You just kind of have to find the right one for your pet.
Yeah, for sure. And any of our staff members at our store are more than happy to help you or show you different options. So collagen we do have in powder, and then depending on your pet, you could also consider something like the primal bone broth, just because of all the good gelatinous things in there from them cooking their bones and making a really thick, awesome bone broth. Absolutely anti-inflammatory. CBD is a super powerful anti-inflammatory. There's lots of herbs that are actually really awesome anti-inflammatories that we suggest in the store. Sometimes it's learning, asking some clarifying questions, learning a little bit more about your pet or what you've maybe already tried with your pet, learning a little bit more about their constitution. So for example, I'm the type of person that I typically run cold. Mm-hmm. And of course, turmeric is the latest and greatest herb out there, and it is a really great anti-inflammatory. However, because of my constitution, it just doesn't work well with me. So I could take, 8 capsules of turmeric a day and get no pain relief. I could take 2 capsules of ginger and almost have pain relief in 30 minutes. So really depends on your constitution. There's 3 or 4 other herbs that we really, really like. Boswellia, yucca, really, really do a great job at inflammation and reducing inflammation. And reducing pain even. Mm-hmm. So yes, we do have multiple types of CBD. We have it in capsules, we have it in tinctures, we have it in treats, we have it in honey. So lots of different ways to get it into your pet depending on how they are. And once we learn a little bit more about your pet. I love that you bring up inflammatory diets. So there's lots of food. And pretty much most dry foods are inflammatory. So getting some sort of fresh food into the diet can be really beneficial. Even just doing some ingredient reading. So looking at the ingredients of the pet food that you currently feed, if there's any nightshade plants, potatoes, tomatoes, eggplant, peppers. Eggplant and peppers are a little bit more unique, but there's a couple companies that will dabble with those. But potatoes especially, they're part of the nightshade family, and that can really fester inflammation and arthritis and things like that in the body. So potato is used often in grain-free foods. That's their carbohydrate source. So they're putting the kibbles together with potatoes. So looking at diet is huge. We have lots of different options for glucosamine, chondroitin. Some even have MSM and hyaluronic acid in them. So that helps with, the joint movement and motion and the capsule, essentially. Fish oils come in liquids or capsules as well. Again, and we even have it in a spray bottle for kitties, which I love. Even you could use it for small dogs because it has a spray top and it'll coat the food rather than just a blob, which we all know cats, we have to ask them nicely to try something. Sometimes little dogs can be picky too. So sometimes that's nice because it's like an even coating on their food rather than asking them to eat a blob of oil or, as the owner trying to figure out how to mix it in or what to disguise it with. So there's lots of different options. I'm also going to throw in number 1 cell salt, calc fluor. So that is great for elasticity issues. And a lot of times, like, Dr. Cole, you had mentioned, is that one knee goes and we have the other one that goes. So sometimes that comes down to there's an elasticity issue in the body, which the collagen is also fantastic for. But why not throw in a super inexpensive homeopathic remedy to also remineralize and support the body? So yeah, there's
so many options.
There are so many options. And again, sometimes it comes down to just stopping in the store so we can ask those clarifying questions. What have you tried? Or, is your dog already on another supplement? And maybe we can find something that coordinates with that and just helps, elevate what you're already doing. So, and there's a lot of misconception about CBD out there. So, there are fantastic brands of CBD, and there are brands that are not educated, and they're just, trying to jump on the CBD train. Mm-hmm. So we want to make sure that we're also giving a full spectrum hemp oil that is going to benefit your pet and not either harm or hurt them. Yeah. There are, I haven't really seen it, but just over the weekend we had somebody come in. I was looking for CBD treats, and they actually had picked some up at their dispensary. Mm-hmm. And when I went back and looked at the ingredients later on, from my trained eye, it looked like it was an isolate, which that is usually a powdered form reconstituted into or rehydrated into the product that they're making. But then on top of it, it had corn and wheat and soy, and it had all these super inflammatory ingredients in it. So you don't want to get the anti-inflammatory that has inflammatory ingredients in it. You want a pure CBD product that is not festering what's already happening with your pet, like you've mentioned. So that's important. Anything I missed? I think I covered a lot. Got it. All right. So let's learn a little bit. Oh, that's not the right one. We did that last week. Let's learn a little bit about chiropractic appointments. So Advanced Animal Chiropractic is at the store 3, if not 4 days a week. So Tuesday evenings, Wednesday mornings, Thursday afternoons, and the second or third Saturday of every month. And if we need to expand hours, Dr. Grant has been gracious enough to throw in a couple Fridays for us. So if something happens, you guys can call us at the store. We can run you through availability and what the schedule looks like and how soon we can get you in for an appointment with either Dr. Cole or Dr. Tully. Initial appointments are $90. Mm-hmm. That's about 20 to 30 minute appointment, correct?
Yep.
And if you just tell us real quick, what happens in the initial appointment?
So our initial is definitely like a meet and greet. We get a full history. We do a full gait analysis, a whole palpatory exam, and then your babes gets adjusted as well. And like Jill said, that's usually 20 to 30 minutes. And then our follow-ups are about 10 to 15 minutes. And it's exact same as the first one. We just don't need the history since we already have it. So it's a little bit shorter, and your pet already knows us at that point. So it's a little bit easier in that sense too. But yeah, super simple.
Great. So, and we can pretty much get most people in that same week or sometimes same day, depending on when you call and how close you live to the store. Yeah. Most of the staff at the Pet Bistro has had our own animals adjusted. So we've been through the process. We understand what it looks like. We understand, when might be a good time or how that all works. So if people have some general questions, most often the staff can answer those for you as well. If you are interested in an appointment and it's after hours or we're not there, if you go to our website, thepetbistro.com, scroll to the bottom, there is book an appointment button, and you can actually book your appointment directly online through our calendar. So if that is easier for you, or I know a lot of people need to match up their calendars or see what's going on because it's changing. Every day changes now.
Totally.
So but we're all more than happy to help folks out and answer questions. And I know you guys are willing to answer some quick questions prior to an appointment as well, if needed.
Always.
Yeah. So it looks like we had a couple of quick comments here. Just JC said, looks like they love watching your videos, and they've seen the other ones on our YouTube channel. So they're excited to see you back on the channel. So that's exciting. I'm glad, JC, that you're joining us and that you are enjoying our videos. So next Monday, same time, same place, 7:30. We'll be back with another topic. If you guys have any suggestions for topics, please put it in the comments below. Of course, we have a list. We always have ideas, but if you guys are interested in hearing about something specific, or your animal's dealing with a problem and you don't know if chiropractic will help it, please let us know. We'd be more than happy to answer any questions for you. So,
sure thing.
All right. Anything else we need to wrap up tonight? Tonight's all about knees.
Got nothing. All about knees.
All right, fantastic. Thank you, Dr. Cole, and we'll see everybody again next Monday.
No problem.